Imagine you're at a grocery store and your elderly parent collapses to the ground. Do you know what to do? According to the American Heart Association in the AHA Journal 2019 guidelines update, there are more than 356,000 out-of-hospital cardiac arrests every year, and about 90% of those die. Cardiopulmonary resuscitation, or CPR, can increase a person's survival chance double or even triple. Hi, my name is Dorann Elam, and I've been a CPR instructor for about 11 years. We're going to cover the 3 basic steps to CPR. Get help, take action, and a little more. Let's continue with our scenario and ask the person, hey, are you okay? But they don't answer. The first step is to get help for an unresponsive person. It's as simple as taking out your phone and calling 911. It's very common for people to panic. They forget to take that phone out and to call and get that ambulance en route. The national average response time for an ambulance is 12 minutes. The faster that you can notify 911, the quicker you can have the EMTs en route. Public places like malls and courthouses have AEDs, or automated external defibrillators, in high traffic areas. AEDs help by giving electricity to the heart, which will allow it to start beating correctly. Instruct a person to find out if there is an AED located at where you are. So far, we've gotten help on the way. Let's continue on saving lives. Next, we need to take action. Compressions is a very important way of taking action. Compressions are the pushing downward in the center of the chest without removing your hands. In cardiac arrest, the heart has stopped pumping, so CPR is going to do it instead. Compression rate needs to be about 100 to 120 times per minute. Healthcare providers would usually suggest to staying alive quietly to yourself to stay on rhythm. Compressions by themselves is considered hands-only CPR. But that's not the only way to take action. Another way to take action is to add breaths along with those compressions. Adding breaths with compressions is considered mouth-to-mouth. Mouth-to-mouth is only recommended for somebody that you know their history, like a family member. Studies from the Journal of EMS article AHA endorsed hands-only CPR reports breaths aren't as important as compressions, except in cases of small children. Small children cardiac arrest is usually due to a lack of oxygen. When doing mouth-to-mouth, you want to place your mouth over the victims and then pinch their nose with your hand. Blow just enough air to see chest rise. With infants, your mouth may fit over the nose and their mouth. Now, we have gotten help on the way and we've taken action. Let's finish up with a little more. The little more is going to be the AED. After you're rocking your compressions, a friend shows up with the AED. Compressions need to continue. They're going to work around the compressor. Open up the AED bag and turn it on. The number one malfunction of an AED is nobody turns it on. The excitement of the moment, everybody loses their good sense and forgets the most simple thing of just turn it on. Once turned on, listen to the prompts. The voice is going to prompt you to place the pads. You want to place the pads before you actually plug up the wires. An AED is going to monitor movement of the heart. If you plug up the pads first, it may think that the heart is moving, and it's going to advise a shock when the heart doesn't actually need it. Follow the AED commands until the nights of diesel have arrived. In conclusion, we see that CPR gives a higher chance for survival of your family members. Not knowing what to do is a large reason for people not doing CPR. CPR can be performed in 3 basic steps. Remember, not doing anything is not a reason for not performing CPR.